Biosafety can be defined, according to the European Centre for Disease Prevention and Control, as the containment principles, technologies, and practices that are implemented to prevent unintentional exposure to biological agents and toxins or their accidental release. In simple terms, it may be described as protective measures that should be taken for any dental procedure to control the spread of microbial infections. Most countries and jurisdictions have strict regulations and comprehensive guidelines for biosafety in dental practice. This module provides an overview of the principles of biosafety and their importance. For detailed information on mandatory biosafety measures, it's necessary to refer to locally applicable and up-to-date regulations and guidelines. On completion of this module, you should be able to describe the rationale for biosafety requirements in a dental practice, recognize that standard precautions have been described to prevent cross-infection and cross-contamination, indicate the need for an aseptic protocol, identify methods for ensuring biosafety in the environment. Cross-infection can be defined as transfer of infectious agents. Cross-infection can occur from person to person or from inanimate objects within the clinical environment. Biosafety measures in dentistry are aimed at reducing the possibility or risk of cross-infection occurring in the dental clinic, thereby producing a safe environment for both patients and dental personnel. Biosafety measures are important in any dental practice because dental procedures carry risks of potential transmission of infectious material through cross-infection. The use of aerosols and irrigating solutions, for example, can cause splatter, which in turn may be transmitted by inhalation or by coming in contact with conjunctiva. Equally, inadequate sterilization of contaminated instruments and equipment used on one patient may transmit infectious organisms to another patient. Serious environmental concerns may also arise out of inadequate disposal of dental waste. The rationale for biosafety in dental practice is therefore to protect the dental health care personnel, patients, and accompanying persons, as well as the environment, against the spread of infectious microbes through cross-infection and contamination. The potential chain of cross-infection will be discussed in this learning objective. The term chain of infection refers to the spread of microorganisms from a host or carrier to another susceptible individual through various methods of transmission. There are therefore three links in the chain of cross-infection: host, method of transmission, and susceptible individual. Theoretically, almost any disease or microorganism can be transmitted in the dental practice setting, but there are some diseases that are of specific importance. The diseases of specific importance include viruses such as human immunodeficiency virus, or HIV, hepatitis B, and hepatitis C, due to the severity of the diseases they cause. Also included are the bacteria that cause tuberculosis and other respiratory tract illnesses. More recently, prion diseases have emerged as a new challenge to infection control. Prions are described as small proteinaceous infectious disease-causing agents, and they're responsible for diseases such as variant Creutzfeldt-Jakob disease. Pathogenic fungi and protozoan parasites are further examples of other microbes that can possibly be transmitted in the dental office. For the first link in the chain, there are many potential hosts that could be a source of infection. These include patients presenting for treatment and dental healthcare personnel, as well as allied staff, all of whom can be potential sources of infection. Host individuals afflicted with an acute phase of an infection can easily be recognized as a source of infection. The majority of hosts, however, are healthy carriers of infectious organisms, and they're more difficult to identify. These types of hosts are described as either convalescent carriers or asymptomatic carriers. Convalescent carriers have recovered from the acute phase of the disease, but still carry the pathogenic organism. Whereas asymptomatic carriers are people who have never had any symptom of the disease. As an example, Most carriers of the hepatitis B virus are clinically healthy and are completely unaware of their infectious status. It can also be difficult to recognize people who are presenting in the prodromal phase of an infection, which is the period before the onset of the acute phase of a disease. Thus, any and every patient, regardless of background or medical history, must be considered as a potential carrier and a source of infection. This forms the basic principle of standard protocols. For the second link in the chain, infection can be transmitted from one person to another by the following methods. The first is by direct contact, where infection is directly transmitted from one person to another. Two examples of transmission by this route are chickenpox and sexually transmitted diseases. The second type of transmission is the indirect route. This route occurs when an intermediate carrier is involved in the spread of microorganisms. Two examples of intermediate carriers are fomites and vectors. Fomites are non-living objects like instruments, and vectors are living agents like insects. The third is inhalation, where pathogens are exhaled or discharged into the atmosphere by an infected person and then inhaled by another person. An example of this route is influenza. The fourth is inoculation, where the spread of infection occurs due to a penetrating injury. This type of injury is most commonly from a sharp object, such as a needle stick injury. Specifically for inoculation injuries, the rate of infection is dependent on the size of the inoculum and the type of pathogen. In regard to the size of the inoculum, needles with a hollow lumen are more capable of transmitting infection as compared to solid suture needles. An example of significance of the type of pathogen is hepatitis B, which causes infection at a higher rate than hepatitis C or HIV. The third link in the chain of infection is the susceptible individual. A susceptible individual is defined as someone who is at risk of becoming infected. Susceptibility varies between individuals, and it may also vary within the same individual. Factors that may influence susceptibility to cross-infection include age, nutrition, stress, state of any disease present within the individual, as well as a compromised immune system. Rationale for biosafety requirements. Key learning points. Cross-infection is defined as transfer of infectious agents. Biosafety measures are important in any dental practice because dental personnel, their patients, and accompanying persons are susceptible to potential cross-infection. Chain of infection refers to spread of microorganisms from one host or carrier of disease to another susceptible individual via different methods of transmission. Theoretically, all microorganisms and diseases can be transferred in the dental office, but a few are of specific importance because of the severity of the disease caused. The majority of potentially infectious carriers are non-symptomatic, and all patients should therefore be considered as potential hosts or carriers and sources of infection. Infection can be transmitted via a number of methods, such as direct contact, indirect contact, inhalation, and inoculation. Specifically for inoculation injury, the size of inoculum and type of pathogen have a bearing on the rate of infection. Susceptibility varies between individuals and within an individual and may depend on a number of factors. The term standard precautions has replaced the term universal precautions. Compliance to standard precautions is considered the basic standard of care for every patient in a dental practice. The principle behind standard precautions is that any patient and every patient, regardless of background or medical history, must be regarded as a potential carrier and a source of infection. Most countries have local regulatory bodies that issue comprehensive and regularly updated guidelines that prescribe measures necessary to comply with standard precautions. Clinicians should adhere to the standard precautions prescribed in their jurisdiction. Local guidelines will include tenets for personal protection, patient protection, and environmental protection. Measures for personal protection refers to the use of barrier techniques such as adequate hand hygiene, use of protective gloves, adequate facial protection, and appropriate clothing, including head covers. Other examples of measures for personal protection include prevention of infection from the needle and other sharp instruments, immunization of dental healthcare workers, and management of inadvertent exposures. Protocols for management of inadvertent exposures are important as, despite taking precautionary measures, sometimes accidents do happen. Accidents in which infectious materials are splashed onto mucosa or non-intact skin, and percutaneous injuries are both considered significant exposures. Standard precautions to prevent cross-infection. Key learning points. The basic principle of standard precautions is to consider any patient and every patient, regardless of background or medical history, as a potential carrier and a source of infection. Compliance to standard precautions is considered the basic standard of care for every patient in dental practice. Local regulatory bodies issue comprehensive and regularly updated guidelines for measures to be taken in compliance with standard precautions. Standard precautions include specific requirements to ensure personal protection, patient protection, and environment protection. Personal protection measures include hand washing, barrier techniques using preventive clothing, as well as precautionary measures to prevent injuries. In spite of precautions, accidental exposures can happen. From a biosafety perspective, dental procedures can be divided into two categories. Non-invasive procedures, such as implant prosthodontics, as opposed to invasive procedures, like implant surgery. If invasive procedures are undertaken, an aseptic protocol needs to be followed. This is important for patient protection. An aseptic surgical protocol can be defined as the methods used to prevent contamination of wounds and other susceptible sites by organisms that could cause infection. Basic components of aseptic protocols include disinfection and cleaning of the operatory environment before and after each patient, use of sterile gloves, appropriate pre-surgical skin disinfection and oral rinses, and clean sterile instruments. A further important component is appropriately trained assistants to assist the operating clinician. To ensure that instruments are clean and sterile, they require correct care. This care involves a decontamination cycle with cleaning, packaging, sterilization, and storage for reusable instruments before they are fit for clinical use again. The first step is cleaning. This refers to the process of removing organic and inorganic debris from the instruments and does not substitute for sterilization. Instruments with blood, pus, and tissue debris, if not cleaned, will compromise sterilization and disinfection. Residual debris may also lead to corrosion and rust. It might be beneficial to use thermal or ultrasonic cleaners to clean instruments such as implant drills, as they may be extremely difficult to clean satisfactorily using manual methods. Instrument manufacturers generally provide detailed instructions on the care of instruments. After cleaning and before packaging, it's important that instruments are thoroughly dried. This is to avoid rust and corrosion of the instruments, which could happen if they are wet when packaged. Packaging prevents contamination of the instruments when they're removed from the sterilizer, and also provides a means of storage, keeping instruments ready for immediate use upon opening. Packaging is followed by sterilization, a process by which all forms of life, including spores, are destroyed. Steam sterilization using an autoclave is a fast, very effective, and economical method that can be used in the dental practice. The fourth step in the cycle of cleaning is storage of instruments. packaged instruments should be stored in dry and clean conditions. In an aseptic protocol, the dental assistants need to be appropriately trained. It's also generally helpful if the surgeon is assisted by more than one assistant. This is to allow at least one assistant to remain scrubbed in throughout the whole surgical procedure. According to the functions they carry out, the possible roles can be categorized into three groups. The first is an operating assistant, who may either be a colleague or a suitably trained assistant. The operating assistant actively assists during the surgical procedure. The second is a circulating scrub assistant, who ensures that the operatory is clean prior to the procedure and sets up the surgical tools. After scrubbing in, he or she helps the surgical team to put on gloves and gowns and also supplies surgical tools during surgery. The third circulating assistant does not participate directly in the surgical procedure. He or she oversees the procedure, performs material documentation, and also provides additional instruments and supplies, such as artificial bone substitute materials and implants. Aseptic protocol. Key learning points. Dental procedures can be divided into invasive and non-invasive procedures. Aseptic protocol is required for invasive dental procedures. Aseptic surgical protocol can be defined as the methods used to prevent contamination of wounds and other susceptible sites by organisms that could cause infection. An aseptic protocol includes clean and disinfected operatory, sterile gloves, pre-surgical skin disinfection and oral rinses, and clean sterile instruments, as well as appropriately trained assistants. Reusable instruments need to be cared for correctly as they undergo a cycle of cleaning, drying and packaging, sterilization and storage before being used again. 2 or more assistants allows one assistant to remain scrubbed in throughout the surgical procedure. All healthcare providers have a responsibility to ensure biosafety in the environment, as well as to ensure that adequate methods of waste disposal are in place. Each city or town has a sanitation department that specifies regulations concerning waste disposal. A dental practice must adhere to their local rules and regulations. For the purpose of infection control, waste from a dental practice is usually divided into general office waste and biomedical waste. General office waste is similar to residential waste and hence does not require any special disposal methods. Biomedical waste is classified as hazardous waste and is subject to local guidelines and regulations for specific means of disposal. This is to ensure that it's handled safely to protect public health and the environment. An example is the separation and collection of sharps in a puncture-resistant, leak-proof container that is specifically designed for their management and is labeled with the universal biohazard symbol. Environment biosafety. Key learning points. Healthcare providers have a responsibility to safeguard the environment through adequate means of waste disposal. Dental practices should refer to local rules and regulations regarding waste management. As a general rule, waste from a dental practice is segregated into general waste, biomedical waste, and sharps. Biomedical waste and sharps are considered hazardous, and specific requirements for safe disposal apply to both. Biosafety in Dental Practice General Principles Module Summary. The rationale for biosafety in dental practice is protection of dental personnel and patients from cross-infection and protection of the environment from contamination. Compliance with standard precautions is considered basic standard of care for every patient in a dental practice. The principle behind standard precautions is that any and every patient, regardless of background or medical history, must be regarded as a potential carrier and a source of infection. Aseptic protocol is required for invasive dental procedures. Biomedical waste and sharps are considered hazardous, and healthcare providers have a responsibility to safeguard the environment through safe disposal of both.